So what makes for a safe sleep environment for your baby? That's what we're going to consider today. Hi, I'm Dr. Obidi, board certified pediatrician, practicing for over 17 years. And my passion is to come alongside a new mom to equip her and to help her show up confidently for her newborn baby. And today we're going to talk about safe sleep. So there are 5 things I'm going to cover that make for a safe sleep environment for your baby. And all of this helps to reduce the incidence of sudden infant death syndrome or SIDS. And that's why we care in the first place, to make sure that our babies are sleeping in a safe environment. So number 1 is back to sleep. So this is placing your baby on your back when it's time to sleep. And it's important that you do this for the first year of life. And somewhere about 4 to 6 months of age, they're probably going to start turning over and flipping onto their sides or their belly. And it's okay to leave them in whatever position they end up in. But to go to bed, you put them on their back to sleep. Number 2 is to have a firm surface that is free of all obstruction in your baby's sleeping area. So that's going to be using a mattress that's approved for infant sleep, as well as having no plush toys or blankets or things of that nature right around that sleep surface, or avoiding things like having your baby sleep on a pillow in their mattress. All of that have been shown to increase the risk of sudden infant death syndrome, and something we absolutely want to avoid. Number 3 is to room share but not bed share. So that is to have your baby, especially in the first 6 months of life, is encouraged to have their sleeping surface, like a crib for instance, right next to your bed, but trying to avoid as much as possible having your baby sleep in bed with you. There are a few sleepers that have been made for babies to where you can have a sleeper in the bed with you, and because there are no studies to show if they contribute to SIDS, the American Academy of Pediatricians has not recommended or come against using one of those sort of sleep arrangements. So again, best is to have a room share but not bed share. And number 4 will be to use a pacifier. And so a pacifier is interesting because it has been shown to decrease the risk of sudden infant death syndrome when it's introduced to your baby at bedtime while they're falling asleep. Now, if it falls out of your baby's mouth, you're not encouraged to put it back in, but to leave it out, and that still does show to still contribute to a reduced risk of SIDS, just the fact that they went to bed with one. Now, some babies will refuse one, and so you're not encouraged to try and force your baby to take one. And the other thing to consider is if you're exclusively breastfeeding, to wait until you, as much as possible, until you have firmly established breastfeeding before you introduce a pacifier to your baby. And number 5 is going to be just other environmental things. So for instance, not overheating your baby. There is a tendency for us to put too many layers on a baby. So it's recommended not to have more than 1 extra layer on your baby, because that may contribute to overheating, which can increase the risk of SIDS. And you can tell sometimes if a baby is too hot by them seeing a baby who's sweating or feeling the temperature of their chest and feeling that very hot. Again, no more than 1 extra layer. I'm also avoiding cigarettes exposure, so secondhand smoking. That does increase the risk of SIDS, or just using any mind-altering substance when you're caring for your newborn. So there you have it. 5 things that can contribute to a safe sleep environment for your baby. Number 1 is back to sleep, having them back on your back when it's bedtime. Number 2 is going to have be having a firm surface that's free of all obstructions. Number 3 is going to be to have them in your room but not in your bed. And number 4 will be using the pacifier where possible. And number 5 is going to be just avoiding secondhand smoke and mind-altering substances used in mom or caregivers, and not overheating your baby. Well, I hope this has been useful. We certainly wish you a most wonderful time caring for your baby. And I'll be honest, these aren't necessarily very easy recommendations when you're caring for a newborn, especially in those first few weeks and months, where most caregivers are just exhausted. But I will tell you that it's doable, and it's encouraged to, as much as possible, adhere to those recommendations. And this is coming from a dad who dropped his 4-year-old daughter while trying to rock her to sleep on a rocking chair. Yes, This was after a long overnight shift in my residency days, and it was horrifying. But luckily, she did well, and she's in pre-med right now in college. So that particular situation turned out well, but that's not always the case. So I certainly understand the plight of the new mom and dad caregivers who are exhausted caring for a newborn, but these recommendations are to create some safety for your newborn. So there you have it. I look forward to coming back again with some other educational material that I hope will be useful to you. Well, bye for now. Hi there, it's Dr. Obidi, and thank you for watching this video. I hope it was helpful. If you enjoyed it, go ahead and subscribe to the channel and click the notification button so you don't miss an episode. Now, as a father of 3 and a pediatrician practicing for over 17 years and caring for thousands of newborns at this point, I know that caring for a newborn or expecting to care for one can be quite challenging. And so that's why I have put together my free resource guide called the Confident New Mom Guide. Links are in the description below. I really cover all the key things that moms typically find challenging as they prepare to care for a newborn. So go ahead and check it out. I know it'll be useful to you. And thank you again for watching this video. I'll see you back here again soon. Bye-bye now.